hand, foot, and mouth disease. HFMD is a common viral illness primarily affecting young children, though it can also occur in adults. It is caused by various viruses, most commonly the Coxsackie virus A16 and occasionally enterovirus 71. Symptoms: HFMD typically presents with the following symptoms: fever, often the first sign of the illness, which can be mild to moderate; sore throat, discomfort in the throat can accompany the fever; rash, hand, small red spots and sometimes painful blisters on the palms of the hands; foot, red spots and sometimes painful blisters on the soles of the feet; mouth, painful sores or ulcers in the mouth, including on the tongue, gums, and inside the cheeks; loss of appetite, due to mouth sores and discomfort; irritability, especially in young children who may be uncomfortable or in pain. Causes and transmission: HFMD is caused by viruses that are spread through direct contact, contact with an infected person's saliva, nasal discharge, or feces; touching surfaces or objects contaminated with the virus and then touching the mouth, nose, or eyes; droplet spread, respiratory droplets from coughing or sneezing; fecal oral route. The virus can be present in the feces of an infected person, and transmission can occur if proper hygiene practices are not followed. Diagnosis: HFMD is diagnosed based on medical history and physical examination. Healthcare provider will review symptoms and examine the characteristic rash and source. Laboratory tests. In some cases, especially when symptoms are severe or unusual, tests such as PCR polymerase chain reaction can be used to detect the virus in samples from the throat, stool, or other bodily fluids. Treatment: there is no specific antiviral treatment for HFMD. Management focuses on relieving symptoms, pain and fever relief. Over-the-counter pain relievers and fever reducers, such as acetaminophen or ibuprofen, can help alleviate symptoms. Hydration. Encourage fluid intake to prevent dehydration, especially if mouth sores make eating and drinking uncomfortable. Topical treatments. Mouth rinses or gels can help soothe painful mouth sores. Rest. Ensure adequate rest to help the body recover. Prevention to reduce the risk of HFMD. Good hygiene. Wash hands frequently with soap and water, especially after using the bathroom and before eating. Avoid touching the face, especially the mouth, nose, and eyes. Avoid close contact. Keep children with HFMD away from school or daycare until symptoms resolve and they are no longer contagious. Disinfect surfaces. Regularly clean and disinfect surfaces and objects that may be contaminated with the virus. Avoid sharing personal items. Do not share utensils, towels, or other personal items with someone who is infected. Complications: HFMD is generally mild and self-limiting, but complications can occur, such as dehydration, due to difficulty eating or drinking because of mouth sores. Secondary infections. Bacterial infections may develop in areas affected by the virus. Rare neurological complications, such as viral meningitis or encephalitis, particularly with enterovirus 71. Conclusion: hand, foot, and mouth disease is a common viral illness, especially in children, characterized by a distinctive rash and mouth sores. While there is no specific treatment, managing symptoms and practicing good hygiene can help alleviate discomfort and prevent the spread of the disease. Most people recover fully within a week or two. If symptoms are severe or complications arise, it's important to seek medical advice.